There have been several trials now that have explored the addition of checkpoint inhibitors, either as monotherapy in breast cancer or in combination with chemotherapy. And in looking at the composite of these data that have now been available to us, I think it's fair to say that checkpoint inhibitors as monotherapy have really modest benefit. And the greatest benefit appears to be when checkpoint inhibitors are added to systemic chemotherapy, and potentially even when added to radiation therapy. But the data, my takeaway in reviewing it all is that combination therapy of checkpoint inhibitor with chemotherapy offers advantage, and also utilizing this combination in the earliest line of therapy, such as first line triple negative breast cancer, is advantageous over sort of saving this therapy for later line where the benefits just do not appear to stand up. In my practice for patients with advanced triple negative breast cancer, I tend to subscribe to single sequential agent chemotherapy. The combination of a checkpoint inhibitor, although a doublet, is not, I wouldn't consider doublet chemotherapy, if you will. And so addition of checkpoint inhibitor for me is often to single agent chemotherapy. There are places perhaps where we look at doublet chemotherapy, such as the combination of carboplatin and gemcitabine. We know that combination chemotherapy may offer a higher response rate. It has not borne out to show that combinations improve overall survival. And we know that toxicity sometimes is more challenging and more difficult to manage. So the setting in which we may use doublet chemotherapy are those patients that need a rapid and profound response. But then oftentimes I will drop one agent and proceed on with single agent chemotherapy, and then if appropriate, continuing their checkpoint inhibitor.